Hello, my dear. I'm Dr. Ala Musbah, Professor of Obstetrics and Gynecology, Faculty of Medicine, Mansoura University. Let us try to answer some MCQ in gynecology. Choose the one best response. The first question: the most effective treatment of primary dysmenorrhea in a woman who doesn't require contraception is which of the following? The most effective treatment for primary dysmenorrhea in a woman who doesn't require contraception is which of the following? A. Dipomedroxyprogesterone acetate. B. Birth control pills. C. Gonadotropin releasing hormone agonist. D. Estrogen supplement in the luteal phase. E. Prostaglandin synthase inhibitors. Choose the one best response. Okay, the best one response here is prostaglandin synthase inhibitor. Okay, go to the next. The portio vaginalis is what part of the cervix? The portio vaginalis is what part of the cervix? A. That which extends cephalad from the vagina. B. That which protrudes into the vagina. C. That which forms an internal isthmus. D. That which is normally covered with endocervical epithelium. E. That which opens into the uterus. Choose the one best response. The one best response here is B. That which protrudes into the vagina. Go to the next. Which of the following characteristics of the normal ovary is correct? Which of the following characteristics of the normal ovary is correct? A. They normally remain constant in size throughout a woman's lifetime. B. They are supported by the round ligaments. C. They secrete hormones and store germ cells. D. They lie in the false pelvis. E. They are immobile. Please choose the one best response. The one best response here is C. They secrete hormones like estrogen and progesterone and they store germ cells. Okay. The growth of coarse hair in androgen dependent body regions is referred to as which of the following? Again, the growth of coarse hair in androgen dependent body regions is referred to as which of the following? A. Masculinization. B. Defeminization. C. Virilization. D. Hirsutism. E. Androgenization. Please choose the one best response. The one best response here is hirsutism. Somebody may say virilization, but virilization, yes, there is excess androgen, but also associated rather than hirsutism, associated with deep voice, hoarseness of voice, enlargement of the clitoris, masculinization, different other criteria. Okay? Okay. So the best one response, the one best response here is D. hirsutism. Next question. As regard precocious puberty, which one of the steroid effects is not reversible and has major long-term implication. Again, as regard to precocious puberty, which one of the steroid effects is not reversible and has major long-term implications? A. Epiphyseal closure. B. Hair growth. C. Genital development. D. Breast tissue development. E. Fat redistribution. Please choose the one best response. The one best response here is A. Epiphyseal closure. Okay, let us go to the next. The commonest site for metastasis from ovarian carcinoma is the commonest site for metastasis from ovarian carcinoma is A. Brain, B. Liver, C. Uterus, D. Peritoneum, E. Bone. Please choose the one best response. The one best response here is peritoneum. Okay? Okay. Next. Screening is most effective in preventing which of the following cancers? Screening is most effective in preventing which of the following cancers? A. Vulva, B. Cervix, C. Endometrial, D. Ovary, E. Fallopian tube. Please choose the one best response. The one best response here is B. Cervix, because cervix has a screening program. I mean, in cervical carcinoma we have a screening program already done in different parts of all over the world, and this is very valuable to decrease the incidence of invasive cervical carcinoma. Okay? Okay. Next question. Which of the following is thought to be a mediator for dysmenorrhea? Which of the following is thought to be a mediator for dysmenorrhea? A. Interleukin 8, B. aromatase inhibitor, C. prostaglandin F2 alpha, D. monocyte chemotactic factor 1, E. oxygen free radical. Please choose the one best response. The one best response here is C. prostaglandin F2 alpha. Okay, go to the next question, please. Which of the following is the most appropriate and accurate test to confirm the diagnosis of Asherman syndrome? Which of the following is the most appropriate and accurate test to confirm the diagnosis of Asherman syndrome? A. ultrasonography, B. antinuclear antibody assay, C. hysteroscopy, D. lupus anticoagulant assay, E. saline hysterography. Please choose the one best response. The one best response here is hysteroscopy. I mean, the best one response is C. hysteroscopy, because hysteroscopy visualize the uterine cavity, and if there is intrauterine adhesion, what's called Asherman syndrome, can be diagnosed accurately with hysteroscopy. Okay? This is the last question. Thank you. Just look to this picture to remember my 4 books published on Amazon: textbook of obstetrics, textbook of gynecology, contraception handbook, and lastly multiple choice question published soon about questions belong to obstetrics or gynecology or contraception in this MCQ book. And this is my site on Amazon as an author, and you can get them through amazon.com. Thank you.